Welcome to the Plastic Surgery Playbook.
Glad to be here.
So, you look at a celebrity, right? Someone who seemingly hasn't aged a single day since, 2005,
Oh, yeah, we all do it.
and you think to yourself, wow, they must use an incredible moisturizer, or maybe they just, get those fancy laser treatments.
Right, the magical creams.
Exactly. But you'd be wrong, because what you are actually looking at is a highly guarded $100,000 surgical secret.
It really is.
Today, we are completely demystifying the modern gold standard of facial rejuvenation, which is the deep plane facelift. We are going to unpack what it actually is, how it fundamentally differs from those stretched out, kind of infamous procedures of the past.
Yeah, the ones everyone is terrified of.
Right. And we'll get into why highly regarded surgeons are recommending it, despite a price tag that it will absolutely make you do a double take.
It's a massive shift. Aesthetic medicine has completely moved away from the era of just pulling skin tighter and hoping for the best. Now we're looking at incredibly complex structural surgeries that physically restore youthful anatomy.
And to really understand how this works, we've pulled insights from some of the absolute top minds in the field.
Some really incredible surgeons.
Yeah, our top source for this audio is Dr. Shim Ching. He's a board-certified plastic surgeon practicing in Honolulu, Hawaii, and the guy has performed over 30,000 procedures.
Which is staggering.
Seriously. We are also bringing in the extensive expertise of Dr. Carl Truesdale, a double board-certified facial plastic surgeon out of Beverly Hills, and Dr. Joel Kopelman from New York City.
Okay, let's unpack this. Before we can even begin to understand how a modern facelift fixes aging, we really have to understand what is actually happening under the skin as we age.
Yeah, because it's definitely not just about the surface layer getting wrinkly. That surface level thinking is, it's honestly the biggest misconception out there.
People just see the wrinkles and stop there. Exactly. People look in the mirror, they see jowls forming or like a heavy neck, and they immediately assume their skin is just getting loose.
Right.
But aging is fundamentally about the descent of much deeper structures. So beneath your skin, there is a thin layer of fat, and below that is something called the SMAS.
The superficial musculoponeurotic system, right?
Yeah, think of the SMAS as the structural scaffolding of your entire face. It basically holds the muscles and the fat pads exactly where they belong.
And reading through Dr. Kopelman's notes, it finally clicked for me how this scaffolding is secured. Because you have these things called retaining ligaments.
Yes, the ligaments are crucial.
They act almost like the anchor cables of a suspension bridge, right? Like they are fibrous bands that connect your facial bones straight through the fat and muscle to the underlayer of your skin, holding everything up.
That's a great way to visualize it.
Yeah.
But over time, gravity just relentlessly pulls on that biological suspension bridge.
It never stops.
Right. So the retaining ligaments actually stretch out and lose their elasticity. And when those cables loosen, the fat pads that used to sit high up on your cheekbones just drop down toward your jawline.
Which creates that heavy look.
Exactly. And Dr. Kopelman points out that these changes actually begin far earlier than most people think, often starting with subtle mid-face hollowing or under-eye shadows in your late 20s or, early 30s.
Wow, that early?
Yeah. And by the time you hit your 40s, that downward descent accelerates noticeably. That is when you really start to see the loss of crisp definition along the jawline.
The pronounced jowls forming and all that laxity in the neck.
Exactly.
Wait, hold on, though. Let me push back on Dr. Kopelman's stance for a second, because my social media feeds are flooded with, the latest heat devices, ultrasound treatments, radiofrequency microneedling.
Oh, I'm sure they are.
We are constantly told these energy devices are the future of anti-aging. Why do we even need scalpels and 4-hour operating room sessions if we can just laser our way back to youth?
What's fascinating here is the critical distinction between improving skin quality versus achieving structural lifting.
They aren't the same thing.
Not at all. They treat two entirely different layers of the problem. Dr. Kopelman is very firm on this physiological reality. No energy device, whether it is high-intensity focused ultrasound or radiofrequency, can physically lift a fallen facial structure back to its original position.
So relying on a laser to lift a fallen face is ironing a shirt that's 3 sizes too big.
Oh, that's a perfect comparison.
The fabric might look incredibly smooth, the wrinkles are completely gone, but it still doesn't fit the contours of the body. You haven't actually tailored the garment.
And that captures the limitation perfectly. Those devices are fantastic for treating the canvas. They improve skin texture, tone, they erase fine lines, and they stimulate surface collagen.
Which is great.
It is. But they cannot counteract the gravitational drop of the SMAS layer or shrink those stretched-out retaining ligaments. And this widespread misunderstanding of what lasers can actually do leads patients right into what the industry calls the filler's trap.
Yes, the filler's trap. Dr. Ching gives a massive warning about this.
It's so common.
People start noticing that sagging, maybe a little heaviness around the mouth, and they go to a local med spa. And the provider there doesn't perform surgery, right? So they offer the only tool they actually have, which is dermal fillers.
Right, they try to camouflage it.
Exactly. They try to camouflage the sagging jawline by pumping heavy gel volume into the upper cheeks, attempting to create the illusion of a lift by just inflating the face above the droop.
And, initially, a tiny bit of filler can provide a nice refreshed look by rounding out a hollow area. But as the face continues to fall with age, the patient goes back for more.
They always go back for more.
Yeah, and the injector adds more filler, trying to aggressively mask the deepening folds. But here's the issue. Dermal fillers are hydrophilic, meaning they naturally draw in water.
Oh, wow.
So now you are adding heavy water-retaining gel to a structural scaffolding that is already collapsing under its own weight.
Oh, man. So it literally accelerates the descent.
It absolutely does.
And you end up looking inflated, puffy, and totally distorted. We see this with celebrities all the time, right? They don't look younger, they just look oddly swollen.
Especially when they smile and all that heavy gel pushes up into their eyes.
Right. That is the dreaded filler face.
Because the physiological goal of rejuvenation should always be to restore anatomy, not to simply inflate it. Plus, as Dr. Ching notes, these fillers generally only last about 1 to 2 years before they begin to migrate or break down.
So you are constantly going back.
Exactly. Spending thousands of dollars annually, and you are never actually fixing the underlying structural drop. Once facial aging becomes structurally pronounced, camouflage just no longer works.
So since you cannot just inflate or laser a fallen face back into place, surgeons have to physically lift it. But how they do it has completely evolved.
Radically evolved.
It makes me think of an analogy about restoring a beautiful antique armchair.
Okay, I like this.
If the internal springs of the chair have completely collapsed, just taking the exterior upholstery fabric and pulling it tighter is a terrible idea.
Yeah, that won't fix anything.
Right. It's going to make the chair look warped, it won't be comfortable to sit in, and eventually the fabric is just going to tear from the sheer tension. You have to open up the chair and physically reset the springs.
And historically, plastic surgery was essentially just pulling the fabric tight. That brings us to the first tier of facelifts, which is the skin-only lift.
The old school way.
Right. This is a highly outdated method, though. Some older surgeons do still perform it. The surgeon literally just lifts the skin, pulls it horizontally toward the ears, trims the excess, and sews it up.
Okay, if you're listening to this right now, take your fingers, place them near your cheekbones, and pull your skin hard back toward your ears.
You see exactly what we mean.
That tight, stretched, distorted look where your eyes sort of narrow, that is the outdated skin-only lift. It creates that infamous wind tunnel or swept-back look that makes everyone so terrified of bad plastic surgery.
Because skin was never biologically meant to support the heavy weight of the deeper facial tissues and fat pads.
It's just a covering.
Exactly.
Yeah.
When you put all that structural tension entirely on the skin, it distorts the natural shape of the mouth, it stretches the corners of the eyes, and worst of all, it fails quickly.
How quickly?
The skin simply stretches out again under the weight within a year or two. Gravity wins, the face sags again, and the patient is left with visible, stretched scars.
Ouch. So to fix that massive flaw, the industry evolved to the second tier, which is the SMAS facelift.
A huge step forward.
Yeah, this is a step deeper. Instead of pulling the skin, the surgeon goes in and tightens that muscular scaffolding layer we talked about, the SMAS. Dr. Ching notes that pulling the SMAS provides much better structural support than a skin-only lift.
It definitely does.
And it generally costs somewhere between $15,000 and $35,000 in the U.S., and it gives you a solid, respectable result that lasts about 5 to 7 years.
It is a vast improvement over skin-only techniques because it finally addresses the deeper tissues. However, in a standard SMAS lift, the face is still tethered by those deep retaining ligaments we mentioned earlier.
The anchor cables?
Right. The surgeon is pulling against those biological anchor cables, which severely limits how much natural lifting can actually be achieved.
Here's where it gets really interesting. The deep plane facelift.
This is the absolute pinnacle of current surgical technique.
The gold standard.
Exactly. In a deep plane procedure, the surgeon goes entirely beneath the SMAS layer. They meticulously navigate through the deeper facial structures to physically cut and release those retoning ligaments.
Completely detaching them.
Yes. Those tethering points, holding the fallen tissues down. By completely detaching them, the surgeon can take the fat pads, the muscle, and the connective tissue and reposition them straight upward as one single, unified structural block.
So they're completely resetting the internal springs.
Perfectly said.
And the true magic of this technique is that once that deep structural block is securely anchored in its youthful, elevated position, the overlying skin just gently drapes over the new framework.
That's the key.
There is absolutely zero tension on the skin itself. The skin isn't doing any of the heavy lifting.
Zero tension on the skin is the secret to an invisible surgery. That is why the results look so incredibly natural. You maintain your exact natural expressions, your smile doesn't look weirdly stretched, and your earlobes aren't pulled downward into that telltale pixie ear shape.
It just looks like your exact face from 15 years ago.
Exactly. And because the heavy lifting is done by the dense structural deep tissues, Dr. Ching points out that a deep plane facelift lasts 12 to 15 years.
That's doubling the longevity of older techniques.
It really is.
Now, when you start researching this on your own, you get bombarded with a ton of marketing buzzwords.
Oh, the buzzwords are everywhere.
You will hear clinics promoting endoscopic facelifts or mini facelifts. I always assumed endoscopic meant better or more advanced because it just sounds so high-tech.
It sounds futuristic.
Yeah, but looking at Dr. Truesdale's notes, I realized it's literally just a camera.
It is crucial to understand the medical language here so you don't get sold the wrong procedure. Patients hear endoscopic and imagine a minimally invasive miracle. But endoscopic merely describes the visualization tool being used.
Just a tiny camera?
Right, a small camera inserted under the skin so the surgeon can see without making a massive incision. It does not dictate the anatomical depth of the lift.
So it's not a deep plane just because there's a camera.
Exactly. An endoscopic approach is phenomenal for lifting the upper face or the brows through tiny incisions hidden up in the hairline. But if your main physiological concern is heavy jowls or a sagging neck, an endoscope alone cannot mechanically fix that heavy tissue descent.
And what about the mini facelift? Everyone loves the sound of a mini recovery and a mini price tag.
Well, a mini facelift simply refers to a shorter incision. It usually stops just around the earlobe rather than extending fully up into the hairline behind the ear.
Okay, so it has its uses.
Sure. It is an excellent targeted option for someone in their early 40s with very mild laxity who just wants a quick cleanup of their jawline. But Dr. Truesdale warns that a mini lift often entirely fails to address deep structural sagging in the mid-face and neck.
So if you have real sagging, it's not going to work.
If you have moderate to advanced aging, a mini lift will leave you incredibly disappointed because it simply does not provide the surgical access required to move the anatomy that is actually fallen.
Achieving that flawless, invisible, comprehensive result of a deep plane lift requires immense specialized skill. Which brings us directly to the massive sticker shock.
It's a big number.
Yeah. Mastering the deep plane facelift is not something every board-certified plastic surgeon can do.
It is widely considered the most technically demanding procedure in facial plastic surgery. I mean, the surgeon is operating intimately close to the delicate facial nerves that control your ability to smile and blink.
That's terrifying.
It is, and the pricing reflects that extreme reality.
Dr. Ching is very transparent about his pricing. He charges between $75,000 and $120,000 for a deep plane facelift.
Which is a huge investment.
Which immediately makes you wonder, is that just a Beverly Hills or Hawaii luxury markup? I mean, how can anyone logically justify spending $100,000 out of pocket for cosmetic surgery?
If we connect this to the bigger picture, the math and the logistics actually start to make a lot of sense. First, consider the sheer time and resources consumed. A deep plane facelift is a massive, intricate medical undertaking. It takes 4 to 6 hours in the operating room.
4 to 6 hours. And Dr. Ching notes that operating room time alone costs the surgeon between $1,500 and $2,500 an hour.
Just for the room.
Right. That covers the sterile environment, the specialized lighting, the massive array of surgical instruments. So you are looking at up to $15,000 just to rent the room before the surgeon even touches a scalpel.
Plus, you also have to factor in the board-certified anesthesiologist's fee, the facility fees, the nursing staff. But the true premium you are paying is for the surgeon's hands.
Their expertise.
Exactly. You are paying for an intimate, obsessive mastery of facial anatomy. This is the farthest thing from an assembly line surgery.
I loved what Dr. Truesdale said about
Oh,
this.
Tiano and crochet.
Yeah. He talks about how the microscopic fine motor skills required to navigate around those facial nerves are things he has honed his entire life.
Yeah.
He actually credits playing the piano and crocheting from a young age for developing his elite surgical dexterity.
It's incredible. You are paying for a medical artist who can maneuver beneath your SMAS layer without causing permanent nerve damage.
Let's also look at the actual return on investment, though, like the financial ROI over time.
Let's do the math.
If you pay $75,000 for a deep plane facelift and it reliably lasts 15 years, that breaks down to roughly $5,000 a year.
Right.
Compare that to the standard SMAS lift. It might look cheaper up front at $25,000, but it only lasts 7 years. That's about $3,500 a year.
Except you would have to go under general anesthesia, endure the painful recovery, and take weeks off work twice as often to get the same longevity.
Exactly. And if we look at the non-surgical route, the math is even more glaring. People routinely spend tens of thousands of dollars on temporary fillers, neurotoxins, and dissolving threads every single year, desperately trying to avoid surgery.
They endure constant appointments, only to achieve far lesser, often unnaturally puffy results.
The filler face.
Yes. When you calculate the cumulative long-term costs of being stuck in that filler trap, that $5,000 a year for a permanent foundational structural reset is remarkably competitive.
And with plastic surgery, the ROI isn't just a spreadsheet of financial costs, it is deeply emotional.
So emotional.
Dr. Truesdale shared a powerful story about a 72-year-old patient who had effectively stopped taking care of herself because she felt invisible.
That story really got to me.
They got her medically optimized, performed the surgery, and the morning after, he handed her a mirror. She just broke down in tears. She hadn't seen that sharp jawline looking back at her in decades.
Wow.
That level of restored confidence alters how you carry yourself, how you interact with the world, how you engage in your relationships.
It provides a profound, life-altering psychological boost. And this emotional return is exactly why Dr. Kopelman strongly advocates for considering a deep plane facelift in your 40s rather than waiting.
Interesting.
Historically, the medical community thought you had to wait until you were 60 or 70, until your face was completely drooping, to mathematically justify the trauma of the surgery.
The old mindset was basically waiting until the wheels completely fall off before you bother fixing the car.
Exactly. But Dr. Kopelman argues that in your 40s, you are likely at the absolute peak of your career trajectory and your social life. Your body is robust and healthy, which usually means you have zero medical comorbidities. You bounce back faster. Much faster.
Yeah.
That makes undergoing a 6-hour surgery incredibly safe, and your cellular healing time is significantly faster. Why wait until you are 70 to enjoy looking vibrant and refreshed?
Makes total sense.
Getting the structural work done in your 40s allows you to enjoy that emotional ROI during the most active, highly visible decades of your life.
We've established the financial math makes sense and the emotional return is massive, but you can't just buy that emotional ROI, you know? You have to physically earn it.
You really do.
What is the actual physical toll to get this result? You don't just hand over a credit card, take a pleasant nap, and wake up looking perfectly refreshed. The recovery is a serious medical journey.
It is a major medical trauma to the tissues. A smooth recovery actually has to start weeks before you ever step foot inside the operating room. Dr. Ching outlines strict, non-negotiable pre-op preparations that patients must adhere to.
The most critical one being the absolute, unwavering ban on smoking and nicotine. He requires patients to stop all nicotine intake 6 to 8 weeks prior to surgery.
It's vital.
And the physiological reason why is terrifying skin necrosis.
It's as bad as it sounds.
When a surgeon separates your facial skin to access the deep plane, that skin relies entirely on microscopic blood vessels to stay alive. Nicotine acts as a powerful vasoconstrictor. It basically causes those tiny vessels to clamp shut. If the freshly lifted skin doesn't get a steady supply of oxygenated blood, it literally dies, turns black, and requires complex skin grafts to fix.
It is a devastating, permanently disfiguring complication that is entirely preventable by just following instructions. So nicotine in any form, vapes, patches, gum, is strictly forbidden.
No exceptions.
None. Beyond that, you have to medically optimize your blood to prevent excessive bleeding, which is the primary cause of severe bruising and prolonged swelling.
So that means completely stopping all NSAIDs like Advil or aspirin.
Yes, cutting out alcohol and halting herbal supplements like turmeric, ginger, and high-dose vitamin E, all of which thin the blood.
To actively aid the healing process, Dr. Ching has patients start taking specific supplements, though,
Yeah, he recommends bromelain.
which is an enzyme naturally found in pineapples, right? To physically break down the proteins that cause swelling.
Exactly. He also adds vitamin K to support healthy blood clotting and arnica montana to mitigate the severity of the bruising.
Those supplements make a tangible difference, but you still have to face the daunting timeline of tissue healing. Like, the first 48 hours post-op are intensely uncomfortable.
Very uncomfortable.
Patients are heavily wrapped in compression bandages. They often have surgical drains sutured into their neck to pull out excess fluid so it doesn't pool and cause a hematoma. And the face feels incredibly tight and entirely numb.
But surprisingly, though, patients rarely describe it as sharp, agonizing pain. It's more of an overwhelming claustrophobic pressure. You are required to sleep propped up on your back to let gravity help drain the inflammatory fluids downward.
This is where the process gets psychologically grueling. If you wanted this procedure so badly and you paid a premium for it, why does Dr. Ching observe that almost every single patient experiences profound regret during that first week?
Is the brutal shock of the mirror.
The mirror.
When those heavy bandages first come off, you do not look like a younger, refreshed version of yourself. You are severely swollen, heavily bruised in shades of deep purple and black, and often noticeably asymmetric because one side of the face always swells more than the other.
Oh, wow.
You look like you have been in a severe car accident or suffered a terrible allergic reaction. Patients understandably panic. Their brain screams, "What have I permanently done to my face?"
I would panic too.
But it is entirely normal. It is simply the body's acute inflammatory response rushing white blood cells and fluid to heal a major surgical trauma.
It is just an intense phase you have to mentally weather. By weeks 2 and 3, the dramatic, dark bruising fades into lighter yellows and greens, and you can usually cover it effectively with thick makeup and go out in public wearing sunglasses. But your tissues are still 50% swollen.
Which leads to the hardest part of the entire process for many highly driven patients, which is patience.
You just have to wait.
At 3 weeks, you look socially acceptable to a stranger at the grocery store, but you still do not see your true result in the mirror. The residual microscopic swelling takes months to fully dissipate from the tissues.
And the numbness.
The numbness around your ears and along your jawline can persist for what feels like an eternity. The tissues are still internally settling into their new positions. The final, magical result, where the skin finally feels soft to the touch again, the jawline contours are razor sharp, and the nerve numbness is completely gone, takes a full 6 months to manifest.
6 months. That requires some serious mental endurance. We just talked about how critical patience is for the swelling to go down, but how the tissues actually heal, and specifically how they scar, is highly dependent on the patient's genetic skin type.
Yes, very important.
This brings us to a crucial point raised by Dr. Truesdale, who brings a vital perspective on how this procedure affects skin of color. We have all heard the cultural phrase, "black don't crack."
Right. And Dr. Truesdale agrees that melanin-rich skin possesses immense structural advantages. It typically has a thicker, denser dermis layer that strongly resists the fine, creepy surface wrinkling you often see in lighter skin types.
But the deep tissue still falls.
Exactly. As he eloquently puts it, black doesn't crack, but it bends, and we can unbend it. Meaning the deep structural descent, the drooping of the heavy fat pads, and the gravitational drop of the SMAS layer still physiologically happens to everyone, regardless of how much melanin is in their skin.
So the underlying architecture still falls, but treating it surgically requires a masterful touch, especially when it comes to the scars left behind.
Melanin-rich skin has a much higher biological propensity for hypertrophic scarring and keloids.
That's where the scar tissue aggressively overgrows the original incision line, creating raised, thick marks, right?
Exactly. A skilled surgeon has to manage this risk incredibly proactively. They have to design the incisions perfectly so they hide deep within the hairline or precisely along the natural creases of the ear cartilages.
No room for error.
None. They must close the skin with absolute microscopic finesse, ensuring zero mechanical tension on the incision line itself. Sometimes they even inject specialized steroids during the healing process to proactively calm the scar cells down.
Wow.
If a surgeon does not have a documented, extensive portfolio of operating on skin of color, that is a massive red flag for any patient.
So what does this all mean? When you pull back and look at the entire landscape of modern facial rejuvenation, it is clear that a deep, plane facelift is a monumental medical procedure.
It really is.
It is not a lunchtime tweak, and it is certainly not a quick fix you decide on an impulse. It demands rigorous anatomical research, a board-certified surgeon with an absolute mastery of the underlying structures, and a profound amount of mental patience during that 6-month recovery roller coaster.
But when executed correctly, it offers a permanent, completely natural structural restoration that no amount of surface laser or heavy filler can ever replicate. It truly represents the perfect intersection of high-level medical science and delicate fine art. And looking ahead at the rapid pace of innovation, this raises an important question. As we see incredible advancements in regenerative medicine, things like stem cell-enriched fat transfers that restore volume and bioregenerative peptides that heal tissues, will the facelifts of the future rely slightly less on physically cutting and moving these structures and more on chemically teaching our own facial tissues to behave like they did in our 20s?
That is a fascinating thought to ponder as technology continues to evolve. Thanks for listening to the Plastic Surgery Playbook.